The following program does not necessarily represent the views and opinions of Reality Radio 101, its advertisers and sponsors, or its listening audience. Listener discretion is advised. Good afternoon and welcome to the Liquid Green Health Show with your hosts Fred and Janet Cox right here on Reality Radio 101. To get on board right now, send us an email. Our email address is liquidgreenhealthshow@gmail.com. And now, ladies and gentlemen, right to your hosts of the Liquid Green Health Show, Fred and Janet Cox.
Good afternoon. It's that time, it's that hour, it's that day, it's that year. This is the Liquid Green Health Show. It's 5:30 p.m. It's Sunday, the 23rd of October, and a warm welcome to the Liquid Green Health Show to everyone, all of our listeners in Toronto, across Canada, the United States, around the world, and thank you ever so much for allowing us into your private space. Today's show is sponsored by Liquid Green Products, producers of eco-superior green cleaning products for your home, office, car, and of course your pets. And if you're not using any of these superior green cleaning products, then what in the world are you using to clean your space? Go to the website. Click on any product you'd like to try. Go to liquidgreenproducts.com and don't forget to enter that promo code. This is the last week that it's going to be on. Just type in RR101. That's the letters RR101 and you'll get a huge discount. This is a live radio broadcast, folks. All of our previous broadcasts can be found on these platforms: Spotify, Facebook, and YouTube. Just type in Liquid Green Health Show. And if you're on YouTube, we want you to like, share, comment, subscribe, do whatever it is to get the word out. We want to hear from you. Write us at liquidgreenhealthshow@gmail.com and let us know where you are listening from. Today's broadcast, like all of our broadcasts, is for education and entertainment purposes only. It's designed to stimulate the mind and help bring us one step closer to living a healthier lifestyle. My name is Fred Cox, and my co-host is Janet. And she, once again, folks, she has left me here in the cold, and she's way over on the other side of the Atlantic in warm Jamaica, enjoying herself. So we got to do something about this, right, folks? We have to do something about this. What can I say? Today, we have an interesting topic. We're going to be talking about hospitals. You know, every once in a while, either yourself, a family member, a friend, or someone, a co-worker, ends up in the place where we don't really want to be, but there are times when we have to go there. So we're going to be talking about hospitals because today, this is the health show, and we've always talked about other things concerning health, your physical condition. We talked about finance, and we try to relate all of those things to health. And so today, we have decided that we would like to know more about the inner workings of hospitals, how they work. And so we've decided to bring a friend along and have that friend explain to us in her words what really happens behind the scenes. So our guest today is a very good friend of ours, Jacqueline Warburton-Golson. And as a matter of fact, this friendship that we have, it's a friendship with my co-host, Janet. That friendship goes way, way back since when they were teeny boppers, right? I mean, real teeny boppers, okay? And it probably goes beyond that. So Without further ado, folks, I am going to hand this show over to Janet, and she's going to take it from here and have a good conversation about hospitals, how they work, with our very good friend, Jacqueline Warburton-Golson.
Warburton-Golson, correct, Jackie?
Yes, it is.
Yes. Frederick, I must say, I miss you.
Oh.
You know why I miss you? Because I'm having challenges. You know the way I like to have my screen with a double screen?
Yeah.
I'm only getting one. So
okay, well,
I can no longer fire you, right?
Because I play an important role after all.
You do.
Okay.
So actually, Jackie and I go back, as you said. We went to the same high school. We started the same high school together, and that's Westwood High School. And as a matter of fact, that's why I upped and left Frederick, because since Thursday, our reunion, our school, if you can see my t-shirt, we're having our 140th year reunion. Happens every 5 years. So next 5 years we will be 145. And school was built. Frederick, bet you can't tell us your quick math. What year did our school start then? Or any of our producers? Let's see.
Sometime in the 19th century.
1882. And we have one of the most unique schools. Wouldn't you say, Jackie, the school on the hill?
Yes, the school on the hill was very unique. I actually should have gone to another school, but I opted to go to Westwood to get away from parents who were very strict.
Because we had boarding school.
But we went to boarding school, which was even stricter. We had a regiment that was very strict that I wasn't prepared for.
Yeah. And you know what? So on Thursday, we had a meet and greet, meet all the girls we haven't seen. On Sunday, I met the only person from my class, Rose Buchanan, and we have not seen each other for 52 years. Right? But I must say, we both still look pretty good. And I want to give a couple of shout outs to some friends, like, Jackie, I don't know if you find this, the people the girls you went to school with in Westwood, no matter how long you have spoken with them, it doesn't matter. Whenever you talk, it's as if you're catching up from yesterday, right?
That is so true.
Yes, because my good friends who are mean, Lois Hendel and Donna Lewis, we don't want to go make this a Westwood show, but Claire Hussang, Janet Shirley, Rose Buchanan, Wyville Engager, Joan Wilson, all of these girls it was just so good to see everyone. And we're sorry you couldn't make it.
Right, but I was in Canada coming home.
Mm-hmm.
I've been away from
mm-hmm.
Right. I've been away from home for 3 weeks. My husband says I shouldn't leave him for so long.
But happy wife, happy life, right?
What's wrong with these women running away from their husbands? What's going on?
But we're doing good work. We're doing business.
Yes. And as a matter of fact, the MC, Doreen, who was the president of the Doreen, she's the president of the Westwood High School WOGA, Westwood Old Girls Association. And there was just a smattering of husbands or of men who came. And she says, I always take my hat off to the brave men, because you know what? They become invisible. Nobody talks to them. It's all about the girls and getting together, right? But the unique thing about our school, the tunic, we had a blue tunic, white blouse, a school pin, a hat, which no other school wears. We have a Jippy Jappa hat. And folks listening, I know we're ranting about our old school. Everybody loves their old school, right? Google WHS, Westwood High School, and you'll see what we're talking about, all right? The school is in need of repair, and anybody wants to donate to Westwood, I'm just throwing that out there. If your school in Canada and the USA is doing great, Westwood is a school that you could a little project. This is my own, just throwing that out there. Okay, if people wanted to donate. But anyway, Jackie, here we are. It was actually good seeing you in Canada just a couple of days before I left, right?
Likewise.
Yeah.
Every every time I come to Canada, you're always traveling someplace. So I was fortunate to find you in Canada this time and to actually link up to have lunch. And we almost went to a play. But that's another story.
Yes. So, oh gosh, it's so hot, folks. And I have to choose between the lights. This is Jamaica, okay? Between the light and the fan. So I chose the light. So, Jackie, you have been for over 20 years. You have been you've been nursing administration. At first, you corrected me. I thought you were hospital administration. Doesn't matter that much because the roles are not too different, right? When I read the job description for administrator for your job, I thought, oh my goodness, why didn't she retire long before this? What is it that kept you so long in this role?
The love of nursing, the love of caring for people, the love of seeing the patients do well and, go back home. I really love my job. And I still do. I try to motivate my team all the time because I see a lot of miserable nurses. And sometimes I wonder if the reason I'm so happy is because I am not actually in the trenches doing the heavy lifting. I'm doing a lot of brain work, a lot of other stress work. And occasionally I do get hands-on because when I make rounds on all the units, if a light is on, I'm going to answer it. I'm not going to pass it by. It could be somebody in dire need. So I love my job for many reasons.
Okay. Now, what's one of the major roles that you play? Let's start. I know there's a list. Which one would you like to start with? Staffing or some of the...
Oh boy.
Where would you like to start?
There are a couple that are right up there with each other, that are vital. Staffing is major because if you don't have the staff, you can't take care of the patients the way we're supposed to. The other major duty is the throughput of our patients. And by throughput, what I mean is from the time the patient comes into the emergency room, there is a process.
What do you call that? The
Throughput, like THROUGH, throughput.
Okay.
And that's moving the patient from the time they come into the emergency room into a room. And we don't always have room because we see anywhere from, on a slow day, 150, 200 patients per day. And sometimes there's a backlog in the emergency room. So we have to have beds on the outside, gurneys on the outside where we actually see patients. So the major thing is getting the patients in, getting them seen. Now, all of that's in the emergency department. I don't take care of that. But when they say we're admitting a patient and we need such and such a bed, then that comes directly to me. And I find the nurse and the appropriate bed, the appropriate skill to take care of that.
So, Jackie, how has COVID affected that? Because hospitals have always been pretty busy, like they're so busy, and it always seems shortages. I know here in Toronto, it's one of the complaints that patients have, that you could go in and spend, believe it or not, 10 to 12 hours in an emergency room. I mean, after they triage you and you have to wait before you actually get a bed. And this is North America. So can you imagine places here like Jamaica? We're actually going to get a Jamaican doctor to come on, hopefully next week, to talk about some of the issues and how they look in opposition to what's happening in the more developed countries. So with COVID, did COVID affect, or how did COVID affect the typical hospital in Florida or just in the States?
Okay. So COVID was a major pandemic where we saw so many deaths. My hospital, which is a smaller hospital, I want to say my hospital is a 500, okay, we're registered for 500 beds, but we don't actually have 500 beds for patients, okay? So our max is, I want to say about 275. Imagine all the beds being taken. The emergency room is full. You literally have to wait for discharges to get a bed. Or we have a makeshift unit in the emergency room. And again, that's only a small space. So when you talk about 12 hours, there are patients in some hospitals that are there for days.
Really?
And there are patients who actually die there because they come in so sick. You saw it happening in New York and in Texas. Fortunately for my small hospital, we did not experience many of the things you saw on television. Okay. They're true. They're very true. We had a lot of deaths and I had to document them. And for every death, I had to send off to the county. That's how they get their count. Okay. So anytime we had a COVID death, I had to pull the records, send the COVID results, send the death papers off to the examiner, the medical examiner. So it affected us in many ways. Shorting staffage was one of them. The major.
Can I ask a question here?
Yes.
I heard you mention the hospital is registered as a 500-bed hospital, but only 275 beds are available. Right. Does that mean that they don't have the extra beds, or is just there's no capacity for more beds?
Okay, so it's very common when a company, a hospital is starting up, you project for more beds because it's easier to get your certification for that many beds in the beginning than to do it in smaller increments.
Okay.
So for the two hospitals that I've ever worked for, we always say we are XYZ amount of beds, but in my 25 years, I can tell you what I know as the maximum. And when I say maximum, we are actually using some of the recovery room areas.
Okay.
Especially during COVID, we had to pull back with doing surgeries.
Okay.
So we got a lot of our staff from out of the surgery areas, out of all the ancillary areas, because we stopped doing surgeries unless it was a big emergency.
So Jackie, this is what I want to ask you. Who makes that decision? Because if you're talking to my family, as opposed to Mr. Brown's family, we can't determine for every family, we're the most important people. How does a hospital make that call to say yes to this person, gets a bed, elective surgery, COVID, whatever, or not?
Okay, so at my level, I can make decisions on certain things, but when it comes on to saying we're not going to have any orthopedic surgery because most of those are elective surgeries. Okay, we're not going to do that. We don't have the staff. We need the staff to take care of COVID. Now, those decisions are made by the CEO, the COO, the CFO, all of the top level,
But is it on the advice of the doctors who are actually seeing the patients?
No, they, so those decisions are made according to best practices. So we're not a standalone. Okay. We are part of a huge conglomerate that probably has 150 hospitals, nursing homes nationwide. So all of these are coming from the head office. And things happen in stages. We don't just, they have to look at a big picture. They have conferences and they try to figure out what's best. Now, if somebody comes in and is having a heart attack and needs open heart surgery, we're going to do it. Mm-hmm. That patient is going to have, because that's an emergency. Correct. But anything that's not an emergency was put on hold.
Right. Okay. Now, I want to go back to the staffing, nurses.
Wow.
Because I know I was in was in Jamaica. I'm in Jamaica, and one of the ladies from Westwood, her name is Janet Kaur, and she has become one of the biggest voices for the Nurses Association here in Jamaica. Okay. And what is happening? This is really a crisis all over. Because as she was explaining to me, not just Jamaica, but lots of the Caribbean countries, some of the poorer countries, they invest so much in their nurses. But you know what happens? You probably soon as they are able, they're picked up by the UK, they're gone to America, Canada gets their fair share. And then we always have a problem in these countries. What's happening there? Why is that? Why are Americans or Canadians are not training more nurses? Why is that the situation?
Okay, so since I've been a nurse 30 plus years, there has always been a shortage, always.
In the US?
In the US, and I think more than the US, even Canada, there's always a shortage of nurses. Mm-hmm. You have people going into nursing for different reasons. Okay. They go into it because they love the profession. Mm-hmm. You find a lot of the younger ones coming into it, it's not because they want to be a nurse. They couldn't care less about nursing. Wow. They find it a lucrative position. They find that if they work hard, which means like 5 days a week, they can make a ton of money. Okay. COVID opened up a Pandora's box. Okay. And I'll explain. Okay. The financial rewards that were being offered by outside agencies, luring nurses away from their current not so well-paying jobs. Mm-hmm. For 4 and 5 times what they were making.
Do you mean like the nursing homes, the private nursing homes, etc.?
No, I'm talking about comparing a nurse in my facility who's been there for years. She is a seasoned nurse, mm-hmm. accepting a travel assignment. They were getting $10,000 and $15,000 per week.
Wow. Okay.
How does a hospital compete with that?
Okay.
A lot of us, my friends, and I have another nursing supervisor that's visiting with me. She actually went to the other room, mm-hmm. and she's been in the business as long as I have. And sometimes we say to each other, we don't have the right people at the top making some decisions. Because if they were just looking at us nurses and saying, all right, you're a 5-year nurse, you're a 10-year nurse, the different grades of nurses, and pay us across the board from Florida to say Texas. Now I know cost of living can be a little bit higher in some place, but make it an even situation. You wouldn't have people chasing from one state to the next. So that's what we found with COVID, where people were being offered these astronomical amounts of money. And then in turn, the hospital who lost all those nurses had to turn around and hire agency nurses at another higher rate. So it didn't make any sense. And
so it was just more pronounced during COVID, but it's been ongoing. They're taking the nurses from the Philippines and all those countries.
Right.
And so they're not investing. The more well-to-do countries, they're not actually spending money on helping these countries to invest in a nursing program. They're just, the countries are spending the money and they're losing. So it's, and then if you have an emergency in a Jamaican hospital,
I know.
like my mom was in the hospital for 5 months and it was an ordeal. The nurses are overworked and they're tired and they're underpaid.
Yes.
No?
I think the nurses in the islands are looking to the lucrativeness of America and also the fact that they can advance. I went into nursing because nursing had so many side roads that you could take. You could become a nurse practitioner, you can become a nurse anesthesiologist, you can go as far as you want to go. And so the United States offers a lot of programs for that. So I think one of the reasons for our shortages, a lot of the young nurses come in, they only stay a couple of years at the bedside and they're gone. Okay. They're gone into legal nursing, because there's so many lawsuits.
Okay.
The patients are suing us. It's a very litigious situation. If a patient is not happy with you, the first thing they're doing, I'm going to call my lawyer.
Okay, which brings me to the next question, which is a big question.
Okay.
The legal side of things.
Yes.
I know there is a code between doctors, like any other profession. There's a code where they technically don't rat on each other. Malpractice is not an easy lawsuit, and it's not for someone that doesn't have a deep pocket. So is it pretty simple, like pretty easy to actually sue the hospital? And if somebody has truly been done damage to, how likely is it that a lawsuit will bring any results?
Okay, so
just before you start, there's a light on your face and it's changing. So I don't know if...
I see what you're saying. Okay, I will move.
Sunlight.
Okay.
I will move.
Yeah, just a little bit.
Well, while she's setting that up, Janet, I just want to retract a little bit when we were talking about nurses shifting from place to place. You have to remember it's supply and demand.
Yes.
And humans have a natural will naturally gravitate to where things are perceived to be better, whether it's more pay, whether it's a better working environment. And unless governments in the countries where these nurses are coming from have the capacity and the willingness to increase the pay, you will always have a situation where wealthier nations are draining those nations, draining the brain drain is going to happen all the time.
Okay, Jackie, are you back?
Yes, I'm back. I was trying to reposition.
Oh, that's better. The light is on. That's better. That's better.
The sun is actually going down, so it's
Great.
Okay.
No, that's better. Great. So we were talking about how easy it is to sue effectively.
Right. Okay. So if you as the patient or the family, because when a patient comes into the hospital, we're not just taking care of the patient, we're also interacting with the family. And sometimes, believe it or not, we might be interacting more with the family than with the patient. Many a times the patients are, very calm, but you have some families, boy, that are on top of you, and they are very insistent on what they want, even though it's not what the doctor, might have ordered. But if you have a case, you can find a lawyer who will decide to take your case. You need to have your documentation. Hospitals tend to have big guns. They have a big legal team. I don't say we cover up. I am not going to say never, because I have never been involved in any situation where I was ever called to give a deposition on anything. Thank God I have never had to be involved in that. but there are legal cases. Our hospital, I know when something happens, if there's a near death, a near miss, we have so many things, protocols put in place, when we're going to do certain procedures, so many checks and balances.
The records that you have.
But if something goes awry, we have to report it to the state immediately. Okay. Like for instance, we have what we call restraints. Okay, when we have patients who are at risk for injuring themselves when they have certain equipment on them, and we might have to restrain them. It might just be a little tie on the hand. There are more, involved restraints. And if a patient dies, not because of the restraint, but if they die and they were in restraint, like within that visit, I have to do a lot of recording. If the patient dies while they're in restraint, I have to report it to the state. I mean, these are things that I can't cover up because there's documentation, like the nurse comes in, has the patient is in restraint. You have to document every hour, every 4 hours, why you're doing it and what you're doing for the patient. So
that's one of the biggest, Jackie, if I can interrupt. So is that one of the biggest areas in your job, is for hospitals anyway, is the record keeping from the time they come through for triage, for acceptance, until the time they leave. Is every single thing documented by every department?
Yes, it should be. It should be.
So how does it happen that patients end up getting wrong medicine and the nurse didn't see? And some of the things you hear about, and you say, how can that happen in a big hospital?
Yes, yes. Like I said, it should be, okay? But mistakes are made. There are nurses who, I don't know if you know this, but there's a high percentage of impaired nurses who come to work and they are under the influence and you don't know it because they're so good at covering it up.
And doctors too?
Now,
of course.
Could that be job related stress, or
it can be a combination. You have people who are nursing that shouldn't really be nursing, but they cover up their tracks so well. And this might only be a small percent, because I have only witnessed it on my time, where I get called by one of my fellow nurses to say, I need for you to come and see this. Or they went in a bathroom and found a syringe, an empty syringe, So
because
this is not anything new.
Right.
And every
job, right. In any job.
In any job, in any job.
But usually the good thing is that you normally hear praise for nurses. It's like the doctors made a mistake and the nurse is the one who found it. So there's that as well. And you hear more of those stories. The nurses and your pharmacists that, they end up sometimes making adjustments for what incompetent or a negligent doctor might do. Now, I want to change the subject a little bit and ask you about a growing trend again since the pandemic, telehealth. Is that having an impact? Is telehealth connected to the hospitals, or are they more private? Or can you explain to us how that works? Frederick, you want to do a...
No, go ahead.
Okay, okay.
Yeah,
okay, so telehealth, pre-pandemic was something new starting up, but during the pandemic, it became even more prevalent. And, it has become a trend, just like how people are working from home. I myself had a telehealth visit with one of my providers, and I had to use my camera to show her something that she needed to look at. And I thought it was kind of neat. You know, I don't have to drive to go to the doctor, you know. So yeah, telehealth I think is cool. I think telehealth is a good thing. But it does not take the place of actually going in to see. You need to go in to see your doctor once in a while. And it's not every situation can be a telehealth situation.
What's the situation like now with insurance for the states? In Canada, you know, we have health coverage, universal health coverage. We all listen to what's happening in the US. And I think it's different for every state. I'm not really sure exactly. Can you enlighten perhaps the Canadians or other people in the world that are listening that are not sure what's happening in the US?
So insurance is really not my forte, but I can just tell you, if you're employed, generally your employer provides insurance, and hopefully it's with one of the top 5, you know, United, Aetna, Oscar, whomever. And then people who are self-employed, who can afford to, they buy. And then when Obama was in, we have Obamacare, which, to be honest with you, I think is super. It's very good for people who are in this country who may not have worked. Like, I've known people who came here when they were 60. They weren't going to start working. They need to have insurance. They don't really have a US income coming in, but they have some form of income, and they're able to buy insurance at a decent rate. Now, having insurance and what it covers are 2 different things. Okay. So you might get insurance, but it might be limited as to what you will get. You may have to pay some more for things, you know, so it all depends. And then there are those without insurance, but you cannot be denied. If you go into a hospital, you cannot be denied service. They have to see you. A doctor has to see you. They have to stabilize you and tell you what you need to do. And we have a lot of homeless people here. And we have a huge population. And my hospital, which used to seem like a more private hospital where we never saw that many, now we're getting the alcoholics, we're getting the druggies, we're getting everything. You know, and many of them don't have insurance, but you will be fined if you turn somebody away, and you cannot ask them for payment up front before they're seen.
That used to be the case, right? That used to be the case, but not anymore. That's what you're saying.
No, I'm just saying, as long as I've been in nursing, you know, that is the case. And there are hefty fines. You can be fined $50,000. The hospital can be fined $50,000 for refusing.
But Jackie, seriously, we have, I'm sure our listeners, they know this too. I'm sure so many people know of someone who was turned away. So is it something that it's on the books, but in reality is not being practiced as it should? And now it's different? Was it always? Because I know somebody personally who had a serious injury to his fingers. And he left it to fester and get sore because he said that he couldn't go to the hospital because he had no money. Was that just his choice, or?
Listen, I know of people who refuse to go because they think they won't be seen. I know that if you come in and you have a laceration, you have to be seen. You have to be stabilized. They might tell you that you need to go see a hand surgeon, and now that becomes another matter, you know, because that's going to cost a lot of money. And the hospital is a business. They will patch you. They will treat you when you come into the emergency room. They will clean you up, but they're not just going to turn you away. I don't know anything like that happening. Not in the
not under your watch. And they will sue you too if you don't pay that bill. because it is a business. Right?
Of course they will.
Of course, yes.
Of course they will.
No, Jackie, a question for you. This is a little bit light. There are so many popular shows on TV. We see the crisis. It started, I think, with Grey's Anatomy, right?
Oh yeah, it's my
You have to
favorite.
excuse the noise in my house. We're in the city in Falmouth, and there's a car wash, there's the cars, there's the kids, there's the dogs. I don't know how much of it you hear, but
I'm
anyway.
not hearing much. I'm not
Okay,
hearing
wonderful.
anything.
I'm hearing everything, and it's so distracting. But anyway, is what happens in a typical hospital? Are any of those shows close to reality? In terms of the daily operations of what we see in the hospital?
Okay, so a lot of times the shows you're seeing, the hospital shows, they're in trauma.
Yeah,
You know, you
right.
see these ambulances rushing
Yes,
in, the
absolutely.
accidents, the fireball, and
Yeah.
all of that. I am sure that stuff happens in trauma hospitals. My hospital, both my hospitals were never trauma. If something comes in, we have to airlift them out, you know, to a trauma facility, or we have to call, you know, an ambulance to take them to a trauma facility.
Okay.
But yeah, they're pretty close, but there's a lot of drama. You know, it's a TV show.
Yes, that's right. And the ratings, it's set up for ratings.
And they have to make it fun,
Mhm.
and they have to make it interesting.
Of course.
You know, so
Now, something else I want to ask you, Frederick, are you sure you don't want to remind people how they're listening to us? And see if we have any emails. I'm not on the email.
Yeah, let me go to the email.
Jackie, hang on for us.
Yeah, we have one from Rita. Rita says, "Hello, Janet and Fred. Thank you for this guest today. Nurses actually run hospitals. They cover doctors' asses all the time."
Okay. We did
And,
allude to that, right?
Yeah, we have one from John, and John is saying, "Hello, Fred and Janet. COVID really kicked the shit out of all of the healthcare system
yes.
throughout the world.
For the world.
Hats off to all of the nurses and staff at these hospitals. Thank you to Jackie for her work and insight." And we have another one here from Andrew. And Andrew says, "Hello to Janet and Fred. Hello to Janet in another part of the world. We are sharing." So she's
Andrew, it is wonderful here. Since I've been here,
yes,
I've gone to the beach at least 5 times in a week.
And here's one from Dan. Dan is saying, "Hello, Fred and Janet, writing in again. Janet, you are totally wrong." I'm emphasizing that statement. You are totally wrong. I don't know what he's talking about. That so-called friend of yours lied to you. There is a law in the U.S. since 1960s called the Graham-Rudman Act that states, like your guest said, no one will get turned down, and no one has. There are laws in place that after you are stabilized and given an exam and told what you need to do, the patient, like most places in the world, needs to do a follow-up. Plus, in the US, there is a Medicaid system that provides health care to all the taxpayers, and the email ends there, right?
Okay. So Jackie,
that should have been read. In the US, there's a Medicaid system that provides health to all that the taxpayers pay for. That's how it should be.
So Jackie, coming back to that question, and I'm glad for that, Dan, for the clarification. Jack, you have already explained that. Do you think there is a level of miscommunication that people don't actually know? Is that possible?
I don't think so.
You see, let me just jump in here. I think, there are myths. There are what you call urban myths, and a story might have gotten out, and as it moves from city to state, it changes. The story changes, and so that gets all around the United States. It gets into Canada that if you can't go to the hospital, I've been hearing that since I came to Canada.
Wow.
In the United States, you cannot go to a hospital without insurance, and if you don't have the insurance, they are not going to look after you. But you've just cleared it up.
It is so It is so far from the truth.
Right.
Let me tell you, like as I said, we have some of the most, what's the word I'm looking for? People who live on the street, some of them because of no fault of their own. Some of them are addicts. They come in with infested feet. Their feet are so bad.
Yeah.
I don't even want to go further to make your stomach turn. And we have to deal with it. We have to cut those stinky clothes off. We have to clean them. Yeah. We have literally maggots jumping out of our rotted flesh. Okay. Do you think we can turn somebody back onto the street like that? Even though we know that we prop them up, we fix them up. Someone like that, you have to admit, because it's gonna take massive doses of medication, right, of dressings. Mm-hmm. He might even lose his leg. And knowing that we do all of that and they're going to go right back on the street, and 6 months later, or even less, they're back.
Yeah. Plus that Hippocratic law that doctors adhere to.
Yes.
They have a responsibility to make sure that you are, well taken care of.
Right.
Even if it's the minimum they're giving you, they have to do their
They
duty.
have to.
Yeah.
Even the ones that aggravate you to no end, that go from hospital to hospital because they're drug seeking.
Yeah.
And they move from one hospital to the other, and every hospital knows that.
Okay.
You gotta bring them in, and then you just don't feed into what they're saying, because every test you can do to them, there's nothing wrong with them, but they're going to tell you, and everything is subjective.
Fred, could I say something if you don't mind?
Sure, please, Gary.
Thank you. And I just want, Jackie, thank you for all that. As you guys know, or I'm sure you know, I was a paramedic in New York for 10 years.
Okay.
And I can concur with everything Jackie has said. What Fred was talking about to listeners around the world, there is a Medicaid system in the United States of America, which is basically a welfare system. Yeah. And a lot of times, I'm not 100% sure of Jackie's hospital, but if someone comes in with absolutely no insurance, whatever, and I used to see this transporting people, Medicaid, a lot of times it was billed out to Medicaid, which is a welfare situation, and the money that is taken from taxpayers that do have health care and pay taxes cover that. So the rumors that we hear in Canada here for decades, absolutely false. Jackie is right on. Yeah. You can even you as a Canadian person can be down there and have no health insurance, no travel insurance, regardless of what might happen later with a bill. They still will treat you and get you stabilized and everything. So that's false.
Right. And I thank you for that, Gary. And our listener, Dan, he laid it out. He said, there is a law in the United States since 1960, the Graham-Rudman Act, that states exactly what you're saying, Jackie. No one will get turned down. So even though folks, I just want to remind you that you're listening to the Liquid Green Health Show. We are Canadian broadcasters. Our guest is an American, but there aren't much difference in the medical care and service that is offered in both Canada and the United States. There might be some differences around the world, but doctors, wherever you are, they had to sign that Hippocratic oath. And once they've signed that oath, they have a responsibility to take care of patients, regardless of the condition. Whether they're rich or poor, they have to take care of you. Okay.
Okay. So, Jackie, a question for you, and this is, again, very general. In a hospital, because we were letting our listeners know how hospitals operate, and just answering some of, this is one of the big misconceptions that you've already cleared up today. So great. What's the relationship with the chain of command? Do nurses really hate doctors, the doctors? And I'm just saying that generally, what's the rapport between the anesthesiologist and, in an operation? Is the surgeon just the again, I'm looking back at some of the TV shows and the drama, but is life in a hospital as opposed to some corporate entities where there's infighting and bickering, or are people just generally all really working for the welfare of all?
Oh, they're humans. They're humans. You're going to have riff, you're going to have conflict.
Wow.
Yeah. How would you deal with
That's a whole lot packed into that question.
I know. In a short answer, because look, we have 10 minutes left.
Yeah,
Oh, okay.
5 minutes actually.
So we are a team in the real world, okay? And we're supposed to work together. And the right hand can't do without the left hand. The doctors depend on the nurses, and yes, we cover them all the time. When they're in their bed sleeping and something happens to one of their patients on the night shift, and we have to call them, we have to paint a story for them and make suggestions to them as to what they should do. Because remember, many of them are fast asleep and you're waking them up.
Yeah.
And, a lot of times they hear you and I am picturing that maybe they might even fall back asleep on you. I don't know. I'm just throwing that in there. But, there is infighting. There is, sometimes lack of communication from one discipline to the next. But, any nurse can talk to any doctor. We don't have to, be afraid, that sort of thing,
Can a nurse make suggestion to a doctor on a patient?
Of course.
Oh,
we do all the time. I'm telling you, because the nurses in the trenches all the time, they work with it, they eat it, they sleep it. I think sometimes the nurses see a lot more that's going on than the doctor. Many of them are book read, but they might not see this thing over and over and over. So yes, we make suggestions all the time. We have to. He might say one thing and the nurse might say, well, how about this? How about giving us some magnesium, some potassium? How about getting a CAT scan? How about, because she's seeing the patient.
Okay. Now, sorry, go ahead. We've been talking about the hospital from the top down, but we should also look at from the bottom up, because the first level, when you walk in a hospital, it's usually pristine. It's usually so clean. So we're talking about from the janitorial staff, the meals, the kitchen staff. Tell us about the other workings of the hospital that actually keeps it running. And you have about 2 minutes.
Oh boy. Well, each department has its own director. Okay, so you have the nutritional services, then under that director, there's the head cook and whatever group of people that work in that team. So, each department that you're thinking of, whether it's respiratory, whether it's the emergency department, the critical care, the med surge, each area has a manager. And many times they have an assistant manager. And then over all of that, there's an executive director of certain units. And then after that, there is the chief nursing officer. And everybody can connect with each other. If you have an issue and you don't think that your manager is taking care of it how you think it should be, then you take it to the next level.
Okay.
I'm not sure if I'm answering what you're asking.
Yes. Because, you have.
But I would say we have an open door policy. As a matter of fact, there's so many surveys. Every manager is now surveyed to see how they're doing with the employees, to see if they are connecting with their employees on a daily basis. They're surveyed, and you are evaluated pretty much based on what the employees are saying about you. And you can be fired if everybody is kind of like making a lot of negative, remarks about this stuff. So,
the last thing I want to draw into this conversation, Frederick, I know if I was here, you'd be nudging me right now. So I'm going to take my final minute with Jackie. And Jackie, in Canada, we get a lot of medical supplies that we get these through a not-for-profit that I'm on the board of. This not-for-profit. It's called Gift of Life Foundation, Global Impact Foundation. And we have been able to bring bandages and gloves and masks and just so many of the disposable doctors' gowns and needles. Like when I say a plethora of products that we get from the big hospitals. How are hospitals funded? That is there always a surplus? Are they ever in danger of running out? Because I always say, oh my goodness, look at all this stuff they give away, or is that just a part of the mandate that it's a part of the budget?
Okay, so.
And that's my last question.
Okay. So yes, many times you'll see an email that comes around that says that there's a shortage of certain supplies, and we have to start watching. And especially during COVID, the mask situation, we had to be careful with our masks. We had to use them over and over again because we were in jeopardy of not having enough masks. As in terms of anything else, sometimes it seems like there's a lot of wastage, things are just laying around. But in terms of donation, I think there's a lot of red tape to give away stuff. And truthfully, I've never been involved in that.
Okay.
So
I'm gonna have to cut it there. Frederick, I'm turning it back over to you. You, Jackie, the thank you for this awesome presentation. Boy,
I was about to bring the hammer down, but you did right. Jackie, we want to thank you. There's another email just came in. It said, this one is from Dave, and it says, again, another amazing show. Thank you very much for the guest, for clarifying stuff to us. And they ended by saying, you two are the best. And Jackie, you have been wonderful on the show. I have learned a lot about the inner workings, but like anything else, there's so much more that could have been.
Yes, that was a smidgen.
Yeah, and
you didn't listen. We never got into the day-to-day staffing and the gray hairs we get from that.
And that there's so much in the inner workings in the hospital, things that we don't know, things we get. We hear stories about tragedies that have taken place in hospitals, and Janet mentioned, there's a perception of covering up going on, but that's the workings in any big institution. You're going to always have negative feedbacks. But again, thank you for coming on the show, and we're looking forward to seeing you more often. Not only when you come to Canada, okay?
In Jamaica.
Right, so. Janet, your microphone is mute.
Okay.
Your microphone.
I was saying we have an open invitation to Florida.
Yes, we do? Okay, good. So now we have somewhere else to go.
Okay, great.
That has brought us to the end of the show. We just have just a minute or so. But for those of you who have just tuned in, if you've missed the show, you can always catch it on Spotify, YouTube, or on Facebook. Just type in Liquid Green Health Show, and everything is going to be coming up there. So don't forget also to visit us at liquidgreenproducts.com. Enter the promo code RR101 and get your discount. And we're going to end the show today by saying good health is central to human happiness and well-being. It contributes significantly to prosperity and wealth and even economic progress. As healthy individuals, we are more productive and even live longer. So until next Sunday, I can hear the music playing. Until next Sunday, same time, same station. This is Janet and Fred Cox saying, stay healthy.
Thank you.
Hey, thanks, Janet. That was fun.
Thank you for listening to the Liquid Green Health Show with your hosts, Fred and Janet Cox, right here on Reality Radio 101.